So on the topic of crisis discriminates, we began to put this webinar together back in March when we're all starting to adapt to COVID. And the focus then was to really think through how crisis disproportionately impacts vulnerable populations. And the truth is, right now we're amid two crises, the COVID pandemic and one that's been present for centuries, which is structural racism. And these two are intertwined. And as we started to think about this more since March, we're also recognizing that crisis does not discriminate. People discriminate. Policies discriminate. How we respond to crisis discriminates. And so we've been reworking this, and we really want two messages to really come across. The first is the first crisis around systemic racism is what causes people to become vulnerable. And when other crises like a pandemic or natural disasters come about, that magnifies the inequities and impacts on these vulnerable populations. Sasha, if you can go to the next slide. If we were to rewrite the title of this, we would probably call it something like Discrimination is a Crisis. And on top of that, additional crisis expose the discrimination that we witness. So I want to start with a little bit of introduction. For people who don't know, at Exygy, we partner with social impact organizations to design and build technology to improve lives and to build healthy and more resilient communities. Our work primarily focuses on the civic and the health sector, particularly on identifying and addressing social and economic factors that impact health outcomes, meaning we work in things like affordable housing, criminal justice, mental health, epidemiology. Our team's staffed with product managers, human-centered designers, behavior designers, software engineers. My name is Eric. I'm a partner at Exygy, and I lead our health and healthcare practice. And on the call with me today, we have Ashna. Ashna, do you want to give a quick intro?
Sure. Hey, everyone. My name is Ashna Shah. I am a product manager here at Exygy. A lot of the work that I do focuses on ensuring that we're maximizing community impact with every digital product decision that we make. And prior to this, my background is in social entrepreneurship and business strategy.
Great, thanks, Ashna. So for the agenda today, we really want to try to answer three questions. Well, one, we want to share a bit about the lessons that we've taken from the past crisis. We want to start to have a group conversation around what can each of us do to empower vulnerable communities. We'll have a breakout sessions in the later half of the session. We strongly encourage everybody to join in and be interactive in those conversations. And then finally, we also recognize that this conversation doesn't end at the end of this hour, but it's something that we want to encourage everyone to continue to talk about, continue to act upon. And we'll share some tips around that. So if you go to the next slide. So coming from healthcare, there's this concept called social determinants of health. And what research has shown is that as little as 10 to 20% of your health outcomes is determined by healthcare. What that means is as much as 80 to 90% of your health outcomes is determined by the economic and social conditions, things that happen outside of the walls. So things like economic stability. What's your employment like? Are you facing housing instability? Are you living in poverty? There's education. What is your early childhood education and development experience? Do you have access to higher education, even high school graduation? There's social and community context as well. Civic participation, incarceration, and the health and healthcare access. Do you have access to healthcare? Are you insured? And finally, neighborhood and environment. So things like, do you have access to healthy foods? Are you exposed to crime and violence within your neighborhood? And if we are to hold this research as truths, we start to ask ourselves, how does this look for someone of color, particularly someone that's Black? And if we just look at the first one, economic stability. And again, if we ask ourselves, what are the opportunities and challenges for someone who is Black to build economic stability and equity? And then if we look at historically, Black families were denied the opportunity to buy homes, especially leading up to the Fair Housing Act in 1968. And what that's led to for families having the inability to gain much equity and be able to pass that down to generations and generations and build a safety net. They were also refused bank loans because of the race. They continue to be refused bank loans because of their race. they're denied job opportunities, they face workplace discrimination. And if you flip over any of these cards, we're gonna find racism and discrimination behind each and every one of these. And so the generations of oppression has prevented the Black community from thriving, lacking equity and safety net to survive economic adversity and other crises that may come about. So at the end of the day, our systems have failed to provide healthcare, education, social support, and on top of all of that, facing trauma, police brutality, and racial profiling on an everyday basis. So these are the things that cause the vulnerabilities. And then, if we go to the next slide, and then if we add a pandemic on top of all of that, how might this impact them? We hear things like, I have COVID symptoms, but my doctor won't order a test for me. But the other patient who is white, who sees the exact same symptoms, do get a test. We hear things like, I cannot distance learn because my school is under-resourced. Or I risk my life for essential work to pay my rent because I'm only left with essential work. Or the one that hits home, I'm not going to wear a mask because I'm more likely to get shot. These are the realities that people face. While these are anecdotes, we're also seeing this in the data as well. So if we go to the next slide. Now, if we do a breakdown by state and we look at percent population by demographic compared to the COVID deaths, we see something that's shameful. If we just look at Michigan alone, for example, we see that in Michigan, about 15% of the population is Black, but nearly 50% of the deaths were from the Black community. So it's appalling. Right? And at the end of the day, Asha, if you can go to the next slide, we do recognize that vulnerability shows up in other populations as well. People who are facing disabilities, particularly in the COVID crisis, are not able to access the care that they need. Children who are relying on school meals, nearly 3 million children who rely on school meals are not getting the meals that they need. The homeless populations already face challenges in accessing basic resources. During this time, they can't even access things like bathrooms. And then when we look at certain communities, especially rural communities, we have limited access or inaccurate data or inconsistent data and news around the guidelines. All of these add so many challenges to make each of these populations vulnerable. So despite the repeated claims that COVID and many crises are an equalizer, this virus has in fact magnified the inequities of the vulnerable populations. So next I want to hand it back over to Ashna to talk through some of the key lessons.
Great, thanks Eric. So as Eric shared, the next thing we're gonna do is look at a couple of key lessons for that we should be keeping in mind and can even start applying in our day-to-day work as we think about how do we shift towards being more equitable and being more just. Before we dive into the key lessons, I want to share a little bit about how we came up with these in the first place. Over the last couple of months, our team has been doing a ton of research into the history of crisis response and humanitarian aid. While COVID-19 is unique in many ways, it's certainly not our first crisis. Humanity has hundreds of years of experience in dealing with crisis response, whether that's responding to previous epidemics, whether that's natural disasters, or even the refugee crises that tend to come up as an aftermath of war. And as we were learning about this history, we started to notice some common patterns. Some common pitfalls that the responders kept falling into, and things that could have been easily avoided if things were just a little bit different. And then as COVID-19 hit and we all started to mobilize, everyone from our federal government to the frontline responders to all of us in between, we started to notice some of these pitfalls all around us again, things that were just a little bit off in how we were responding. So as you guys will see here, we will not only share these lessons, but we'll also share some examples that really demonstrate how things are not quite as they should be, so that we can start thinking about what we need to do differently as we move forward. So The first key lesson that I want to share is that money and resources are not the entire solution. For efforts to be effective, they must be coordinated, they must be built on inclusive policies, and they need to be executed by properly trained and educated teams. So this was an interesting one for me to come across because as someone who works in the social impact space, I was always under the impression that a lot of the issues we deal with come up from the powers that be not allocating sufficient resources or funding the way they should be. And that's not to say that that's not an issue. It certainly is, and we're seeing it play out now. But it's also not a silver bullet. In fact, time and time we've seen again that when large amounts of funding are allocated, but they're not backed by the proper infrastructure to make sure that that funding is allocated equitably and used effectively, it can have some really unintended consequences. At best, we've seen that money go to waste, and at worst, it can actually cause more harm than do good. And there are a couple of lessons or examples that we can look at here. The first is the cholera epidemic that broke out in Liberia back in 2003. When this first broke out, there was a huge outpouring of support from the international medical community. And there was a huge push to make sure that they had enough resources. Particularly, the focus was on creating emergency tent units like the ones that you see in this picture here. Emergency tent units are a great resource, particularly when hospitals are really strapped for capacity and can't take on any more patients. We saw these pop up in New York in Central Park at the height of the COVID-19 outbreak. However, what the team on the ground failed to do back then is actually engage the local community. Locals did not know that this was a resource where they could go for help. So at the end of the outbreak, there were actually lots of tents that never saw a single patient. That's millions of dollars that got wasted. And that's thousands of lives that could have been saved had that money been used in another way. And we're seeing this play out all over again right now. A lot of you might be familiar with the Payment Protection Program. That's the program that has been created by the United States federal government, meant to help small businesses sustain themselves through this crisis. They've invested $649 billion into this so far. And yet, at the end of this, a national survey of 500 Latin and Black-owned businesses showed that 66% of them did not receive any assistance. And at the same time, we're now seeing reports come out of large chains and corporations and even publicly traded companies who did benefit from this program. So to me, this is a clear example of the money was allocated, but it did not have the policies necessary to ensure that it actually got distributed to the places that needed it the most. So I think for those of us in the social impact space, as we continue to do our work and continue to advocate to have the resources, have the funding to do our work effectively, we also need to be thinking about how, what needs to come hand in hand with those fundings, right? Is that a systems of checks and balances to make sure that that money is being spent correctly? Do policies need to be put in place so that there are some guardrails? Maybe that even means making sure that the first thing we do is train our own teams so that they know what sort of things to look out for. And the second lesson that I want to share today is that mainstream solutions address the privileged. For solutions to be effective, they need to be inclusive of all the voices in the community, and they need to be specific to each community. Solutions have to take into account the context within which they're going to operate. There is no one-size-fits-all solution, and yet that's a pitfall we keep falling into again and again during our response to this crisis. The first example that we saw happened early on in the outbreak back in March. a lot of us, all of us really, are familiar with social distancing at this point. When the outbreak first came out, the CDC required all of us to stay 6 feet apart. Social distancing and staying 6 feet apart are only possible if you have the privilege of living in your own home and being able to work remotely. And so a community that was really left in the lurch with this was the homeless and housing insecure community. Particularly the homeless, the housing counselors that were trying to support the homeless folks. Housing shelters are not built for social distancing. The beds are not built to be 6 feet apart. So now the counselors had to make a choice. Do they adhere to social distancing and have fewer beds, serve fewer folks, and risk more people being out on the streets where they might be at a risk of infection? Or do they not do that and actually risk an outbreak within the shelter itself? And this is a really resourceful, creative community. So we saw all sorts of intelligent solutions come up. One in particular was setting up the beds so that people were sleeping head to toe, so that we could use the hypotenuse between folks to increase the distance, so that there's some level of increased safety. But nevertheless, this was a scenario that put a lot of undue burden on a staff that was already stretched very thin during a chaotic time. Had there been more clear instructions from higher authorities from the get-go, not only would that have avoided a lot of stress for the frontline workers themselves, but they could have also mobilized much faster to make sure that they're focusing on supporting the community that they're serving. And the second example that I want to share today really hits home for me the importance of making sure that voices are represented at the table. A lot of us over the past month have seen a push for states to reopen, cities to reopen, businesses to reopen. But a lot of that has been preemptive. It's been against the advice of public health experts. And a lot of that push has been purely driven by economic purposes, feeling like businesses can't be closed for that long. But we have to recognize that those of us that can work remotely are continuing to do so even now and will continue to do so for the next couple of months. The businesses that are being asked to reopen in these initial stages is the service industry. It's our restaurants, our hair salons, our gyms. And the population that's overrepresented in that space are Black and brown workers. So now there's a situation where these folks no longer feel safe or comfortable going back to work, but also don't feel like they have any other choice. Their jobs are at stake. And to me, this is clearly illustrating the disparity between who got to make the decision, who is going to profit from this choice, and whose life is immediately and potentially negatively impacted as an outcome of this. So I think as each of us continue to do our own work and we think about what solutions we might be implementing within our organizations or the services we might be providing, we really need to think about who are all the different groups that might get impacted by a potential solution and think through their needs individually. Because all of them will have different needs, different environments that they operate in, as well as different barriers to being successful. And when we start catering to them a little bit more specifically, we can start making sure that what we're doing is actually effective and actually moving in the direction we want it to. So I want to be mindful of the fact that when we talk about these solutions or these lessons in abstract or these examples that are historical or at the federal level, it can create a sense of, well, what can I do? I can't really change what happened in 2003, and I have little to no power over what my federal government chooses or what my state government chooses. So I want to make sure that we're bringing these lessons back home to us, to the work that each of us are doing, because we do have that, each of us does have the relationships, the power, the privilege to start influencing the change in our communities. And to set the tone for that, I want us to look at this quote from political activist and author Angela Davis. Historically, when one looks at efforts to create reforms, they inevitably lead to more repression. I came across this quote a couple of weeks ago, and it's stuck with me ever since. And I recognize that reading this can create a little bit of discomfort within us. It can even be discouraging, right? Like, especially for those of us who are in the social impact, tech for good space, who are trying to do the right thing. It can be a hard pill to swallow, to make sure that, like, or to think about the fact that the work that we're doing might not have its intended consequences and might not be as effective as we think it is. But I also want us to hold on to that discomfort, because that's the discomfort that's going to propel us forward. I think this can serve as a really good reminder that the status quo that has gotten us here is not going to be what ultimately gets us out of this. And so if we want to start seeing things shift as we move forward, we're going to have to be really intentional about the systems that we're creating in our own communities and in our own spaces. So as we, think about what comes next, I want to talk a little bit about what each of us can do within our organizations and our communities. And I know I'm about to ask a lot out of each of you here, so just bear with me for a second. Over the last month, we've seen a lot of organizations start to take the first step towards doing the right thing. That can look like, setting up donations for the Black Lives Matter movement. It can look like releasing a public statement. It can be a short-term initiative focused on supporting those fighting COVID-19. And while those are all good first steps, the outcomes of that are just as short-lived as those steps. A lot of it can look like performance allyship. It can have short-term gains, such as being perceived as being on the right side of history and being able to leverage these acts for BD and marketing. But if we really want to start seeing long-lasting changes, it's going to require all of us to take a really hard look in the mirror. And, here are a couple of things that have come up with our own internal conversations at Exygy that I'd like to share here. The first is doing an internal audit of any existing services, programs, or digital products. So this came out of a conversation with one of our lead product managers, Lucy Chen, who's on the line here. But she actually brought up the point of there actually might be hidden racial bias within the products that we are creating. Because chances are, if we're not actively counteracting it, we're perpetuating the same systems that we're trying to fight against. So we need to sort of go back and reevaluate. The second is proactively shifting your recruiting, hiring, and promoting practices. So this one hits home for us. Exygy is a majority minority organization. It's a majority female organization. Yet it's a point of failure for us because we don't have a single Black employee. So this is a key indicator that there's something that we're doing wrong here. We're failing at this, and we need to go back to the drawing board, reassess, because these are not the values that we believe in. And then as we talk about, having voices represented at the table, setting up long-term partnerships to collaborate with local community-based organizations and advocates. We can't get voices represented overnight. This is a long-term game, and building trust within a community can take years, but it's worth that investment because a lot of us don't come and don't live in the communities that we're trying to serve. So it's really going to be that very powerful collaboration between our skill sets, our platforms, and those who really know these problems intimately that's going to help us shift in the right direction. And I think when we can start taking some of these steps, we start working towards being a little bit more anti-racist, rebuilding systems with equity in mind, and also shifting internal culture. At Exygy, we talk about this idea of inviting the whole person. And I know these conversations can be awkward and uncomfortable, and it can feel like, oh, well, business isn't the right time to have these conversations. But each and every one of us is dealing with this both inside and outside of work. So how can we truly support each other and empower our teams and empower our employees if we're not actively creating that space to talk about it internally? These are just a couple of examples that we've come up with, but I'm also really aware that there's a lot of other ideas that can, be out there, and we have this really incredible brain trust of folks on the line right now. So I want to make sure that we're leveraging those. The next thing that we're going to do is move into some ideation. Before we do that, I want to recognize that you've had a lot of information thrown at you over the last 20 minutes. So I want us all to take a moment. Go ahead and close your eyes. You can turn off your camera if that makes you feel more comfortable. And just take a deep breath. And think about the communities that you're a part of. Maybe that's the team you're in or the organization that you belong to. Maybe that's your family and network of friends. Maybe it's a service you're providing or a digital product that you're leading. It's anywhere where you have the relationships, the power, the leverage to influence change. And then think about what is one thing that you can do to start shifting that community, that space to being just a little bit more equitable, a little bit more just. What would that look like? And what would be different? How might you apply one of the lessons that we just talked about to that space? And when you've identified what that one thing is, go ahead and join me back here. All right. I hope that something floated up to the surface for each of you. The next thing that we're going to ask you to do is actually share that. We're going to break out into smaller groups of 4 to 5, and we're going to share what came up for each of you.
So I'd like to spend just a few minutes before we wrap up, just hearing from different groups who feel comfortable sharing. Anything that came up for you specifically, any themes that you heard from your groups, anything that was new, or any commitments that you feel comfortable sharing with this group. I'm actually happy to kick it off. I've facilitated one group. Our conversations actually was pretty diverse, and we talked about how for some communities, they are resonating with the fact that there are certain populations that are lacking accessible, accurate, and consistent information, and the way that they're trying to reach out to those individuals, and specifically people of color, is by building relationships with local community-based organizations or faith-based organizations, and even understanding what sources people respect, people listen to, because it isn't always the news outlet. So that was reassuring. We also talked about, from a digital product perspective, how a big initiative that we can do to kind of check our biases when we are doing testing or interviews with the community. Oftentimes we are strapped for time, strapped for budget, and so we immediately tap into our network, which is inherently biased. So if we are being more intentional about that, we can be more diverse just within the process. And then finally, the last kind of theme that we heard is looking internationally and looking at an international perspective. There are certain countries that are vulnerable as the majority, meaning that many people are living that have no more than 1 month's worth of savings. And so how do we tackle something like that? So looking for ideas there.
Thanks, Eric. Katie, I noticed you were about to share earlier.
Yeah, I was just gonna say our group as well was pretty diverse, but one of the things that I liked that one of the group members mentioned was kind of to do like audits within companies and really learn where these money being distributed and how can we make a change to make sure things are going where they're supposed to go. And um, the money that we work hard for, where is that going to, and all that stuff. So yeah.
Someone in our group shared something that really resonated with me around, like, as a privileged person, it's very easy to just kind of put this stuff in a box and kind of put it in a corner. It's like, it's there, it's not good, but it's also something that's like really easy to push aside and just kind of ignore. So that's something that I'm trying to do a little better about.
Natalie, did you want to say something?
Yeah, I spoke too long in our group. I'm still really sorry about that. I think to summarize here, it's doing the inner work first and then taking baby steps to figure out how you can use your influence. And I've had to spend a lot of time thinking about what ways can I be influential. And at the moment, it's in my son's charter school, because there's 2 teacher hires and I'm on the panel. And so guess what? When you post, you get white candidates in Marin County. And so I guess we had, anyways, I'm going to stop there.
I'll share a little bit. I mean, I was in the group that talked about auditing investors to see where money goes to or comes from, for that matter. But one thing that I guess like lingers from there is like more of a question of like, like systematically when things become illegal, like a boycott, divest, or like sanction movement is actually considered illegal, even though that like the kind of core of that movement is to kind of like offset injustice or inequality. Like how do you kind of work around or find like ways to still do the work without putting yourself at more risk, or even like accelerating kind of like what that looks like of like this movement is bad for these reasons when it's actually meant to do something for the greater good.
Yeah, I like those ideas a lot. Yeah, I'm also curious about how do we think about accountability, like Asha pointed out. Is it auditing? Is it continue to educate ourselves? Is it having more tactical things like metrics that we're following up with, or contingencies, or outcome-based donations and things like that? I see Ivy just posted in the chat as well. She said that she's curious about action items after this webinar. Are there action items that people are taking away from this? Certain things that you want to learn more about, or other resources that people are able to share?
I mean, I know Exygy is this fantastic company that has their fingers in all kinds of different sorts of nonprofit and socially based businesses. I would love to hear a feedback and update from the people of the Exygy network, because there might be some things that you were already doing that you didn't realize you were doing, and to hear a follow-up on how Exygy is going forward. Because if you look at all the companies that are out there, Exygy is most in line with the goals that are trying to be achieved, and still kind of reflects on, we haven't done much, we have to do a lot more, we're now aware of this a lot more, what are we going to do next? And I just love to get some input and feedback about it.
Yeah, I really appreciate hearing that, Clifford. Yeah, I think that is something that we can reflect on as a team and see like, what can we share out, or the people within our network, who can we bring into these types of conversations and have them share their experiences. Yeah, I love that idea. I think that's something we can definitely think more about.
I can hop in real quick since I know this is top of mind for a lot of us today. One of my team members actually mentioned the undocumented community. While they got a major victory in it this morning, one of the things that we've seen is that with COVID-19, they're one of the largest populations. that have lost jobs, and they're the ones that are ineligible for any sort of federal aid or support. And so how can we make sure that we're actually able to protect them both through this crisis and any future crises that come up?
So as promised, happy to connect with people offline if you're interested learning more about the work that we're doing, or just sharing more things that you're learning yourself so that we can amplify that within our network. So feel free to reach out to us if you want to keep up to date on what we're doing. Feel free to sign up on our newsletter as well. Any last words, Ashna?
Yeah, I guess I'll just, end this by thanking everyone. I'm just so grateful for all of you that showed up, that are willing to like lean into these conversations. I feel like, in any organization, it can be easier to get really insular and not really know, like sort of like have an echo chamber of ideas, but only when we start looking at, patterns across organizations and start exchanging those ideas, we can really start trying to, see the changes that we want to. And I also just noticed, like within our own groups, even in a matter of couple of minutes, people were just, really leaning into vulnerability, sharing things that they were passionate and excited about. So just really grateful for all of you bringing that energy into the space with us today.